Hi, this is Michelle Christian. I'm the physician assistant at clinic at Aldersgate, and I've been asked to talk to you all briefly about what is a do not resuscitate order, or a goldenrod as they're frequently called here in North Carolina. And what this order is, signed by your physician, is an order that says for medical personnel, should they find you without a pulse, they would not institute CPR or resuscitation. And without that order by your physician, the medical staff or paramedics or doctors or nurses are under the obligation to start CPR, meaning we would do chest compressions approximately 2 inches deep to try to get your heart restarted. Now, as we mature and the older we get, the likelihood of CPR being successful does go down. So when you're in your 70s or 80s, the likelihood of surviving CPR is low, and the likelihood that you would survive a hospitalization following CPR is even lower. Now, all these decisions need to be made on your personal religious beliefs, on your medical history, and in conjunction with your doctor. But I would advise you to seriously consider what your goals are should you become ill. This does not mean any care would be taken away from you. It doesn't take medicines away. It doesn't take IVs away. It doesn't take going to Asbury or the hospital away. But it does mean that we would not try to resuscitate you in the circumstance that you would not be breathing or without a pulse, heartbeat. Now, the second part of this is, given the virus in our community and its community spread, we have to seriously consider more advanced care, meaning if you would somehow be diagnosed with the COVID virus and become ill, would you be placed on a ventilator? We do know that as we get older, especially in our 60s, 70s, 80s, and beyond, the likelihood of survival goes down. And as people become sicker, although there's nothing that can be done medically, the treatment would be put on a ventilator, and many of our patients, especially in their 70s and 80s, don't survive that ventilation support. And so the question is, would you want to be placed on a ventilator in the event that you become severely ill with the COVID virus? And these are, I think, questions that we should all be asking ourselves now. It's out in the community, and we know that we have a limited number of resources that can be done, meaning oxygen, supportive care, managing the temperature, managing our shortness of breath. But should you become so acutely ill that you would need ventilatory support or be placed on a breathing machine, would you want that? And I think that these are questions that we'd like to answer before we get placed in a situation where we're acutely ill. So I'd encourage you to talk with clinic and maybe have a FaceTime visit or a follow-up visit by video so we can discuss these things with you and make the appropriate decisions based on your history. Thank you.